Hi, everybody. This is for how liver stiffness can predict liver disease and the connection to fibrosis and cirrhosis. So, for my bluff, I want to say that nearly 1/3 of the world's adult population has non-alcoholic fatty liver disease. They usually say it's NAFLD, just as an abbreviation, and that will be used throughout this presentation as well. The reason why it says NASH right here is because NASH is a non-alcoholic steatohepatitis, which is a form of the non-alcoholic fatty liver disease, and it's connected to it. So the effects of this are itchiness, jaundice, which is like a yellowing of the skin, and the swelling of legs. There are also other signs of unexpected weight loss. There are indulged like veins, like you can see your veins more, stuff like that. And it leads to risks for other diseases such as fibrosis, cirrhosis. Also, it can lead to death, which is pretty scary. So the main point of this article and this study is to see if there is an increase in liver failure and death with a higher level of fibrotic tissue in your liver. And also, with this study, we're going to be seeing some data on liver stiffness and the connection between fibrosis and cirrhosis due to NASH and also NAFLD, which is age, sex, whether you're female or male, and also just underlying things that you have, like whether you had liver disease already or whether you have other conditions like diabetes, stuff like that. So that's what we're going to be getting into. For this experiment, they test this using non-invasive tests, or NITs, of fibrosis, and it gives a fibrosis score, which is leveled between 1 to 4. We're trying to see how the connection of cirrhosis and fibrosis all connect to this. And studies have shown in the past as well, from research on my own, due to family, and just how they connect to each other and what leads to each other and which one starts first, that type of thing. So for cirrhosis, this is advanced scarring of the liver. So this usually means that you are very, very susceptible to liver disease. Some symptoms could be extreme tiredness, easily bleeding or bruising, loss of appetite, nausea, swelling in the legs, feet, or ankles. This is actually called edema. Weight loss could be unexpected. It's not really a great thing. Itchy skin, like I said, jaundice, which is yellow discoloration in the skin and eyes. There's also fluid buildup in the belly called ascites, which we'll talk about later in the results. They talk about how cirrhosis usually does have that, and it can be related to liver disease. Spider-like blood vessels on the skin. Also redness in the palms of your hands, pale fingernails, clubbing of the fingers, in which like the fingertips spread out and become more rounded than usual. It's different for women and men. Women have an absence or a loss of periods not related to menopause. Or for men, it's a loss of sex drive and testicular shrinkage or breast enlargement, known as gynecomastia. Sorry for my pronunciation. There's also confusion, drowsiness, or slurred speech. Now for fibrosis, this is more of a almost stepping stone to cirrhosis. It's not as severe because it can be reversible if you treat it. So the causes of fibrosis is inflammation in the liver. It's not quite advanced scarring from cirrhosis, but it is still a worry for liver disease, liver stiffness, etc. And some symptoms that you can see is fluid buildup in the legs, weight loss, appetite loss, difficulty thinking clearly, fluid buildup in the legs or stomach, very similar to cirrhosis, jaundice, nausea, and unexplained weight loss, like I said before, and weakness. And also, it's severe enough where you would think you are sick. So, and all of these are related with liver disease. And as the study is going to show, there is going to be lots of connections to cirrhosis and fibrosis with liver disease. All right, questions to be answered. So through this study, here are some questions that I think will be answered or I want to be answered through this article. So is there a connection to liver disease or liver stiffness and fibrosis and cirrhosis? So to me, that's one of the main points and main areas that I would like to know, just to see if maybe there's a way that with this correlation, it can help with treatments. Also, is it different depending on unique factors? And what I mean by that is, does age have a role in whether it's related to liver stiffness or the type of treatment you can do for liver disease and liver stiffness and fibrosis? Also, like whether we're male or female, again, the difference between symptoms of fibrosis was different for men and women. So I wonder if the treatments could be different for men and women. Also, huge as well is how can this help with treatment and prevention? All kind of relating to the other questions is how can we see that the correlation, and how can we make it so we get treated faster, we get treated correctly, and that there is less likelihood of getting liver disease if you catch fibrosis and cirrhosis. So hopefully this will answer every one of those questions. All right, now we are on to the article. So this is a gut microbiome article, because it is talking about the gut and also the liver and just how your body is going to react to this. So starting with the study design and setup, this study used 2 randomized, double-blind, placebo-controlled trials done in all parts of the world, from Europe to North America, South America, Asia, and the Pacific region. We had participants that were 18 to 70 years old, and they had a histological diagnosis of NASH or of liver disease with advanced F3 and F4, that is advanced fibrosis due to NASH. Okay, so the study population, just to get a little bit into it, I know I said that they were 18 to 70, but the participants were solely people who did not already have full-blown liver disease. It was NASH, which was like you're almost there to liver disease, but you have a possibility of cirrhosis and fibrosis and that type of thing. We also saw that there was a history of there was no history of a solid organ transplantation, that it was just all your organs, original organs, no hepatic decompensation or HCC. There were 664 participants that have F3 fibrosis, and 734 that have F4 compensated cirrhosis, who took a serotype, which is pretty much just an indicator or like an activator of seeing like how severe the cirrhosis is, which is 18 milligrams of that. And then serotype 6 milligrams, or a placebo once a day for 48 weeks. And they also did another test for 96 weeks. And that was more just a checkup to see if any of the results changed. In the F3 fibrosis, they had 56% female, 72% white, and 70% that had diabetes. So again, those external factors will be important in this study. Age and BMI, the range was around 51 to 64, again, getting that median of 58, and 32.7 kg per m squared. In F4, 63% were female, 78% were white, and 68% had diabetes. The median IQR age and the BMI were 59 years old, from 53 to 65, and 33.1 kg per m squared. All right, so objectives and outcome measures. So this study was done to determine the best threshold of baseline liver stiffness to predict cirrhosis and fibrosis, to determine if a less than or equal to 5 kPa and a less than 20% increase in liver stiffness, LS, predicts progression to cirrhosis, which is F4, in participants which bridging F3 fibrosis, and liver-related clinical events in participants with cirrhosis. So pretty much what it's saying is the gauge in which that we are finding how much connection and correlation, which would be the kPa, between fibrosis, cirrhosis, and also liver stiffness. We want it to be lower than 5 and 20%, because that will show more of a correlation to that liver stiffness. And we would want to see the increase of cirrhosis and fibrosis and the increase in liver stiffness. And this is just a way to show results in a way we'd use the tests. So let's get on to the results. So the results are going to be separated into two parts. So I have the F3 fibrosis results, and then we will get into the F4, which will be cirrhosis. So for results for F3 fibrosis, they found that 14% of the 664 participants with F3 fibrosis had a less than or equal to 5 kPa, or a less than or equal to 20% increase in liver stiffness. So at the median follow-up of the 16.6 months, which again, like I said, they had the 48-week trial and then they had the 96-week trial. And so this is kind of the median follow-up of that. They found that 16%, or 103 of the 664 participants that was in the fibrosis trial progressed to cirrhosis. And as I explained before, fibrosis is like the stepping stone to cirrhosis, which I found pretty high percentage, and shows the correlation in liver stiffness and how liver stiffness can progress to fibrosis. I found that pretty interesting. There's also, we found through this study that there is a greater risk of cirrhosis with higher liver stiffness. Same with fibrosis. The optimal liver stiffness threshold at the baseline is less than or equal to 16.6 kPa. And progression to cirrhosis with this happens 31.1% of the time. This is actually very high compared to, I think it's 9%, that when you have a greater than 16.6%, 16.6 kPa, which is a very high jump. That is almost fourfold of compared to the less than or equal to 16.6 kPa. Due to these results and everything, we can see that this is a strong and independent predictor for progression to cirrhosis. And just to show this on a bar graph, you can see that it's 9.1% for greater than 16.6 kPa, only 43 out of the 400. And then there's the 31.1%, which had a less than or equal to 16.6 kPa. As you can see, it's almost fourfold, which is pretty significant and shows that liver stiffness does have a huge correlation with fibrosis. So yeah, and just to give the little side note of what the bar graph entails is liver stiffness, or LS, by vibration-controlled transient elastography. The less than or equal to 16.6 kPa is associated with increased risk of progression to cirrhosis and fibrosis along patients with baseline bridging fibrosis secondary to non-alcoholic steatohepatitis, or NASH. And they use the Fisher exact test for the P is less than 0.001. And here's a line graph, just showing the progression to cirrhosis from fibrosis and liver stiffness. Again, with this bridging fibrosis secondary to NASH, stratified by liver stiffness by the vibration-controlled transient elastography, that is less than or equal to 16.6 kP versus the greater than 16.6 kPa. As the months went by, that there was a major decrease in the less than or equal to 16.6 kPa compared to almost the flatlining of the greater than 16.6 kPa, which is very interesting because I'd also wish that they went into a little bit more depth with their study, because I would like to know why it was like a little bit of a flat line between month 12 to month 22. What happened to make the next jump to that lower? All right, for this next part, this is for the F4 cirrhosis. So this is for the testing of cirrhosis and how it correlates with liver stiffness and liver disease. So the study found that 22% of the 734 participants had a less than or equal to 5 kPa and less than or equal to 20% increase in liver stiffness. So that's pretty high. It's even higher than fibrosis. But to me, that makes sense because cirrhosis is just a higher version of fibrosis and is scarring and most likely will lead to liver disease and cause liver stiffness. During a median follow-up of 16.2 months, 4% of the F4 cirrhosis had liver-related problems happen, like ascites. Like I said in the other slide, how we would talk about ascites. Those are many symptoms and things that happen during cirrhosis. That liquid buildup in your liver is one of the main symptoms of cirrhosis. So to have that liver-related problem happen is huge, that it found 4% of that. The optimal liver stiffness threshold at baseline is less than or equal to 30.7 kPa, which is very high, but understandable, like I said, because cirrhosis is permanent scarring on your liver. It's also scary that it happens with non-alcoholic people as well. Just something to think about. Also, liver-related events occurred in 11.1% of the participants that had a less than or equal to 30.7 kPa. And in the next slide, we'll see that there was only like a 1.1% of the participants having a liver event if they had a greater than 30.7 kPa, which I found interesting as well because that's a pretty high jump. For the less than or equal to 30.7 kPa, this has indicated that this is a strong and independent predictor of liver-related events after adjustments for age, gender, ethnicity, and BMI. Like I said, this study was done all throughout the world and with many different ages and the different sex. So, all right, for this next bar graph, this is just like the one that we had for fibrosis, showing that 1.4% when you had a greater than 30.7 kPa versus the 11.1% that you have when you have less than or equal to 30.7 kPa. And just to read off what the graph entails is liver stiffness by vibration-controlled transient elastography less than or equal to 30.7 kPa is associated with increased risk of liver-related events among the patients with baseline cirrhosis F4 secondary to non-alcoholic steatohepatitis, or NASH. And again, Fisher's exact test was used with the P is less than 0.001. And for this line graph, it shows the liver-related events in patients with cirrhosis secondary to NASH, stratified by liver stiffness by vibration-controlled elastography. And as you can see, there is a difference between the less than or equal to 30.7 kPa. There was a decrease in survival of free liver-related events, and compared to actually almost 100% if you had a greater than 30.7 kPa, which is actually pretty interesting, just seeing how liver stiffness related to that. This was more flatlined than fibrosis, I think, just because cirrhosis is already happened, like you have that scarring already, and you probably already had liver stiffness, so to see the difference in that is bigger in fibrosis. All right, so questions that we want to talk about and we can probably answer now due to this study. So did the study between liver stiffness and cirrhosis show that there was a correlation? And the obvious, just outright answer is yes, because the percentages were so high. The studies that they showed with the effects of the indicators and the activators showed that liver stiffness, cirrhosis, and fibrosis all were correlated to each other and can lead up to liver disease. And so the next question is, are there similarities in side effects and signs of cirrhosis, fibrosis, and liver stiffness? And that is another yes. Again, cirrhosis, fibrosis, they all have symptoms of like liquid buildup in the liver, nausea, sudden weight loss, blood vessels being shown more, the enlargement of your fingers and numbness, lack of motivation, like lack of appetite. So yes, there are similarities. And because that we now know that there's a correlation between cirrhosis and fibrosis, liver stiffness also relates to these similarities in side effects and signs. Okay, so which show more of an impact with liver stiffness? So as we saw in the study, there are many ways we can answer this, and I think we'll start with fibrosis. So fibrosis, it shows more of a correlation with liver stiffness in the sense that the percentages were greater, almost fourfold compared to the placebo effects and everything else. But I think there is a reason for that due to fibrosis can be reversible, and fibrosis is the starting of liver disease, starting of that scarring, starting of cirrhosis. So there is going to be that greatness of it because it's building. And then cirrhosis, though, had that 11%, like I said in the bar graph here. It's still very high compared to the placebo and the other studies that happened. So cirrhosis is more advanced, meaning that it's already closer to liver disease and probably already had some liver stiffness. So I think comparing the two in the sense of which one had more of an impact, I think both have a very significant impact. It's just they're at different stages of getting liver disease and that correlation. There's correlations in all of them, but I think that fibrosis gets closer to liver stiffness in the studies because it's still developing versus cirrhosis is already there with that permanent scarring. I'm going to go over to question number 5 first because I feel like question number 4 is actually a great one to all encompass at the end. So does liver stiffness always mean that there could be cirrhosis, fibrosis, or liver disease? Now, in this study, they didn't fully talk about it, but we can see the implications of liver stiffness with cirrhosis, fibrosis, and liver disease. And now we know that cirrhosis and fibrosis are both signs of liver disease and higher risks of liver disease and liver stiffness, and that liver stiffness has a correlation between all of those. So I think it is possible that liver stiffness could mean that there is liver disease, that there is cirrhosis and fibrosis, but there's more of a possibility that you can treat this. And like I said, fibrosis is reversible. So possibly you could even, cure your fibrosis before it can get to cirrhosis or liver disease. And that to me is like kind of the huge thing about this study is that you want to find the problem fast and effectively so you can have the correct treatment and treat it so it can be erased. Like fibrosis can be treatable and reversible. So now going on to question 4 was, why does this study matter? And the reason why I put this very broad question is because I think it's very all-encompassing. Why would we care about the correlation between cirrhosis, fibrosis, liver stiffness, liver disease, etc.? And it's because this is such a big problem in our world. This is non-alcoholic in this study, which is very scary. And there have been studies of people dying to figure out like the correlation and everything could help with diagnosing fibrosis, cirrhosis, so it doesn't get to liver disease, and so we can do the right treatments. Also figuring out the correlation between like male or female and seeing if males react to a certain medicine differently than female. And I was happy to see that the results, that there were some correlation, because if there wasn't, then it would still be a mystery on how to conduct treatments, to conduct diagnosis. So that was kind of a leeway to our discussion. So they found that people with worsening liver disease in 4 large randomized placebo-controlled trials had increasing liver stiffness measurements, and that this was a correlation. The best liver stiffness score to predict progression of the NASH liver fibrosis for cirrhosis in people with severe fibrosis, it's 16.6 kPa, and to liver problems in people with cirrhosis is 30.7 kPa. An increase of 20% in the liver stiffness score means a possible increase in probability of getting cirrhosis. Again, this is how we're talking about the less than or equal to 20% or less than or equal to 5 kPa shows that whenever you have an increase of your liver stiffness or an increase of your fibrosis, there is an increase of probability of getting cirrhosis. Makes sense, but it's important to have the facts, and it's important to have this study done. These liver stiffness scores might help doctors find people at risk at a clinic and in their practice. Again, relating to that question of why does this all matter? It can help doctors find people who are seriously at risk. And here are my citations. All right, thank you so much.